working on maternity in Sally Ward and as a maternity nursery nurse, and been working there for about 4 years. And then one of the neonatal nurses came up to me and she was like, you need to do this. I had a lot of pressure. I feel like I had a lot of pressure from colleagues saying, when are you going to do your nursing? And I just wasn't ready. I just didn't think I could ever go to uni. And then she brought this to my attention and I said, well, I'm not really losing anything. I'll give it a go, and I'm still working, doing what I love. So yeah, I went for the TNA role.
I chose to become a nursing associate because I was looking for a new challenge. I had initially started off working in a GP practice on the administrative side, and they offered me the opportunity to then become a healthcare assistant. Once I felt like I'd reached my ceiling within that role, the opportunity to become a nursing associate presented itself. I thought I needed to find a new challenge, so the next role basically was to take on a nursing associate.
I've always wanted to go into nursing, but I had family commitments, and the opportunity came up for me at a point where I thought, you know what, let me go for it, it's my time. So the opportunity was there, and I thought, yeah, go for it.
I spent 6 years working as a healthcare assistant in the GP setting. I just qualified as a sound engineer. I needed some money. I accidentally ended up on a taught day for HCAs because I started early and it sounded like a day I wasn't working. And next thing I knew, I was seeing patients, and I fell in love with it. And once I sort of reached the ceiling, the TNA course came along at a really good time to provide a platform for me to develop my skills in a way that didn't mean I had to stop working and pay for university and study.
Actually believing in myself and pushing myself, I guess that's been my biggest challenge, and believing in my capabilities, because I always had a lot of people telling me that I was good enough, but I never believed it in myself. So that's probably one of the biggest challenges. Yeah, and now I've got a newfound love for education, and I can see how vital it is.
My biggest challenge has probably been time management, both for uni work, balancing district nursing work and personal life, trying to get lots and lots of things done in a very small amount of time. That can be really stressful, but you just got to believe that by the end of it, it will be worth it.
I was working previously as a healthcare assistant in contraception and sexual health, which I thoroughly enjoyed. I like meeting new people, meeting the youngsters. Everyone was like a nice, tight-knit community. My biggest challenge for this was coming back to study. I found that a bit difficult, and how I would cope with family and work commitments. Overall, I had a very good supportive system.
Gaining knowledge, but also gaining confidence in dealing with conditions that I hadn't come across before has been one of the biggest challenges, but also working with a set of new colleagues and kind of just learning to interact with a myriad of different people, from consultants all the way down to other trainees and students.
It was hard work, but it paid off. I didn't think I'd make it. There was many times when I said to my lecturer, I can't do this anymore, it's just too much, but I'm so thankful that they said, no, you're sticking with it, and they made me see it through. So yeah, that's my proudest moment, completing those 2 years and just sort of leading this new role within the NHS now, and really seeing where it's going to go, how it's going to shape the future NHS, how is it going to, you know, impact the rest of the nursing team, how we can support and provide better care for the patients.
Recognising that I have become a valued member of the team that I work in, and knowing that I can actually provide and give a contribution to the care that we provide to all our patients that come through on a daily basis.
I don't feel I have a ceiling anymore like I used to. I just want to keep learning and keep developing as a professional.
If opportunities arrive, I may go on to further things, but for the time being, I'm very happy within my role as a nursing associate.
A fun fact about myself, I've been shark cage diving with great whites.
I was a qualified sound engineer when I started working in the GP surgery. It didn't pay very well though, so I started working at the GP surgery to gain some extra money during the day, while then I worked in pubs and with bands at night.
I am a huge X-Files fan.
I completed the course